Hi. Thank you, Chairwoman Kolkhorst and members of the committee. My name is Alec Mendoza, and I'm the Senior Policy Associate for Health with Texans Care for Children. Texas currently has the worst uninsured rate in the nation among kids at 10.9%, with around 852,000 kids who do not have health insurance. However, out of those uninsured, there are about 400,000 who are eligible for Medicaid or CHIP coverage, but are currently not enrolled. And this is an issue that stretches all across the state. And we have 12 Texas counties who actually have an uninsured rate that is more than twice the national average. And as we've heard today, coverage is a piece of the health puzzle that is necessary to live a long, healthy life. And for Texas kids, Medicaid is a critical role, a part of that. When children can enroll in Medicaid and other health insurance, it was mentioned today by some of our panelists that they are able to have more reliable access to health care than those who are uninsured. Unfortunately, bureaucratic barriers within our eligibility system are preventing families from enrolling their eligible children into health coverage. Texas' current enrollment system underutilizes data-driven methods and over-relies on manual methods. And this has led to an average of 88 days for a Medicaid application to be processed by HHS, leading to kids missing out on critical medical care. Texas needs a more efficient and accurate approach to Medicaid CHIP enrollments, and the legislature can do that by doing two things. One of them is first passing legislation to establish express lane eligibility so that HHS can use already verified information from another program such as SNAP, so a child's enrollment into SNAP, to be used as an indicator for Medicaid and CHIP eligibility and enrollment. And the legislature can also make investments to improve and upgrade our Texas eligibility system to address some of these barriers that we're seeing. Both of these actions would help slash the children's uninsured rate here in the state of Texas and get kids enrolled into the coverage that they are eligible for. Thank you.
Yeah. Okay. Members, any questions? LaMantia.
Thank you, Madam Chairwoman. And my question for Alec, you said that it sometimes takes 88 days for the enrollment to go through, because earlier we heard from the hospitals say that they can bill for the past 90 days if someone comes in and realizes that they're eligible. So, I mean, is that 88 kind of an average? Does it sometimes extend? Does that mean that now that individual that should be on Medicaid because the process took so long is now having to pay that bill?
So that, that 90 days is retroactive, as the Texas Hospital Association mentioned. This average that we're seeing across HHSC is taking 88 days. That was from an ambassador call that they had, I believe, on March 29th. So I think that number may be a little bit lower now. That was the latest information that we can actually cite. I believe it's around 83 days. But to answer your question, Senator, that's the amount of time that it's taking for an eligibility worker to touch the application. So if they have to answer questions, if there's any issues within that application that maybe they need to get a hold of the family with, it could take longer than those 90 days.
And that could be a barrier to the child receiving care. And
yes, ma'am.
Thank you.